Hey everyone, welcome to Marvel Medicine. So this lecture is on elasticity. What we're going to talk about is, we're going to explain what that exactly means and why is this important to know. Will they test me on elasticity on the USMLE? No, they're not going to specifically test you on elasticity exactly, but what they will do is ask you stuff using the concept of elasticity alongside other medical information. So that's why it's really important to know, and that's why we really focus on these physiology concepts so you understand the concept and then apply it to all sorts of information, to all sorts of organ systems, and I'll show you. We learned about compliance already. Now, the concept of elasticity is a bit similar. The best way to visualize this is a rubber band. So, you stretch it out, and what does it want to do? Contract back, right? That quality of contracting back is elasticity, the force trying to pull back to its original shape. So what makes elasticity? Elastin and other material like it inside the tissue cells and the cell walls. So, tissues that have more of elastin will be more elastic. Let's take a look at arteries now. You can visualize their elastic properties when they get stretched out, how they want to contract back. Compare arteries to veins and see how, although the veins have elastic properties, to some extent, they're not as strong as the arteries' force to go back to the same shape they were originally in. So again, visualize it. Here's an artery, and here's a vein. We fill both with 50 milliliters of blood, for example. The artery is more elastic and less compliant. The vein is less elastic but more compliant, right? So which would have a higher pressure inside after the 50 milliliters of blood? The artery, right? But that's because of compliance. You have to see that the artery wants to contract back to its original shape really bad and resist the change of adding that blood into it. And that's elasticity. Let's take a look at a pathological disease like COPD, chronic obstructive pulmonary disease. Well, what's happening here? Normally, the lungs have a certain compliance and a certain elasticity. They expand with inspiration and contract with expiration. That desire to contract back to the lung's original form during expiration is passive. It's determined by their elasticity. You don't need muscles or anything to exhale. Now, it's all really done because of the elasticity your lungs have inside the tissue, in the parenchyma. So visualize this. When people smoke chronically, that smoke goes into your lungs, goes into your cells, and what it does is it destroys the elastin. And when you destroy the elastin, you're destroying the elasticity quality of those lungs. Imagine taking in a deep breath in this patient who's a smoker. And normally during exhalation, the lungs would want to contract back, but without the elastin, they stay kind of expanded and don't have the rubber band-like quality to pull back. This is the same reason why patients with Marfan Syndrome get aortic aneurysms. Their elastin in the tunica media is destroyed, and without that elastin, the walls stretch out and don't want to contract back.